I was back and forth on the fence for several years with the breast augmentation and lift procedure, basically because of my fear of scarring. But Dr. Chiaramonte was able to alleviate those fears, and I've seen his procedures, so I knew exactly what to expect with that. And I elected to go with the silicone implants. So I'm able to tell my patients now, because the FDA just did release the silicone implants for general use, that, I'm very, very pleased with the silicone. It's not something to be, scared of. They've done their research and it's been noted to be okay.
I just wanted something that I looked a little more, feminine, and, not only was I flat, but my skin wasn't very tight, and it was almost like he did it over the muscle, so I also did a lift with it. So it wasn't like a natural lift. And so I was able to wear things that I couldn't wear before. So, my friends are very jealous. Like, they'll go out, they'll be like, oh, we don't want to go out with you because you get all the attention. So.
Well, I have 3 children, and after having the 3 children, my body was not at all what it used to be. And so my goal was just to be restored to pre-baby, nothing, exaggerated more than what would fit my frame.
Dr. Chiaramonte performs several different breast procedures, including breast reduction, breast lift, and breast augmentation. If you wish your breasts were larger, fuller, or more shapely, breast augmentation surgery may be the right choice for you.
The most common reason patients come is because they feel their breasts are disproportionate to their body size. A lot of women, their breasts really never developed to the size they want it to be. Or if they had, following pregnancy, they've become smaller and have lost volume, and then want to kind of go back to where they started. In general, when I see a patient for a breast augmentation, there's 4 questions that we have to answer, and we do those together. One is size, and I get a good idea of that by finding out what's their current bra size and what their ideal goal would be. The next 3 are what incision to use. The 3 most common are around the areola, in the fold of the breast, or in the armpit. Where the implant goes, whether it's under or over the muscle. There's different reasons I do both. And finally, what type of implant, whether they use silicone or saline.
So the FDA has recently approved silicone breast implants. What does that mean now for the patients?
Well, it means they have a choice. After a very long investigational period, the FDA has determined that silicone implants are safe for patients. I think that silicone feels and looks more natural. Or patients have to be 22 years of age to get it. It does require a slightly longer incision to place the implant, and they are more expensive than saline. Some patients still have some concerns about silicone just because of all the press and the history, and for those patients, saline is an excellent choice.
Over the years, pregnancy, nursing, and the simple force of gravity can take a toll on a woman's breasts. And for these women, Dr. Chiaramonte might recommend a breast lift.
I think the 2 most common reasons that I see women with this condition is that either following pregnancy or following significant weight loss. And it's really my job in doing a breast lift to restore that balance, to make the skin proportionate with the amount of breast tissue.
And how do you decide to use a breast implant with a lift?
It's kind of like my conversations I have with my breast augmentation patients, and that what is your current bra size, and are you happy with your size in a bra? If a woman is, but she just doesn't like the sagging of the breast when she's out of a bra, then a breast lift is the answer for her. But if she would like more fullness, then I usually recommend an implant with the breast lift. That tends to give patients a better outcome and has more longevity than doing just a breast lift alone.
Another common breast procedure is breast reduction surgery.
With any breast surgery, it's all about being proportionate. And usually women that seek out breast reductions is that they feel their breasts are disproportionately large for their body size. Also, patients with very large breasts will frequently have several other complaints. Back, neck pain, grooving in the shoulder blades from the bra, or occasionally rashes underneath the bra. All these symptoms are markedly improved with a breast reduction. A breast reduction is very similar to a breast lift. The main difference is with a breast lift, I'm just removing skin, but with a breast reduction, we remove breast tissue with the skin to accomplish the goal.
If you're like most women who have these procedures, you'll be very pleased with the results. An augmentation, a lift, or a combination of both procedures will mean that you will no longer need padded bras or bust-lifting undergarments. Your new, natural curves will allow you to wear a greater variety of fashions with confidence, whether you're on the beach or in the boardroom.
When I got to meet the girls, they confided in me that they had also been patients of his, and that just boosted my confidence in him that much more. If they were there and they looked as wonderful as they did, then obviously, you know, I was in good hands.
Now, have you yourself had any work done?
Yes, I had a breast augmentation in 2002. 2003. Yeah, absolutely, absolutely. You know, I always said that I wanted to have it done, and then when I started working for him, it gave me the opportunity to actually have it done. And I mean, I like my new figure. Fit in shirts that I wasn't able to before. Again, because I've had several of the procedures, the liposuction and the breast lift and augmentation and the chemical peel, so I can sit there and say to them, yes, it's bad the first day, or no, you'll feel great, you know, it's no need to worry, or you can feel free to call me at any time, because again, I've been there.